Bismillahirrahmanirrahim. Welcome to the course. I am Fuad, Assistant Professor, Department of Pharmacy, Department of Science and Technology. Welcome to the course Pharmaceutical Clinical Pharmacy. Today the topic of discussion is typhoid. Outlines. We will discuss the following contents one by one, like the description of the type of typhoid, the vaccine recommended by WHO, etiology, cause of the disease, transmission, how typhoid can be transmitted from one person to another, the different means of transmission, spread, pathophysiology, like the reason behind the pathophysiology of the typhoid, clinical features and treatment. Okay. Lecture outcomes. After listening and watching, the student will know about the typhoid pathophysiology, its risk factors, and treatment. Typhoid fever. What is typhoid fever? Like we can define what is the typhoid fever is a systemic infection. It is a systemic infection caused by a bacteria that is known as the Salmonella typhi. There is the systemic infection caused by a pathogenic organism like Salmonella typhi. Usually through ingestion of contaminated food or water. The acute illness is characterized by a prolonged fever. The acute illness is characterized by the prolonged fever, like the prolonged fever, the prolonged headache, nausea, there is a loss of appetite, and constipation, and sometimes diarrhea. These are some symptoms of a typhoid fever. The typhoid fever is a systemic infection caused by a pathogenic organism, by pathogenic bacteria like, for example, this is Salmonella typhi, usually through ingestion of contaminated food or water. The acute illness is characterized by the prolonged fever, headache, nausea, loss of appetite, maybe constipation, and sometimes there is diarrhea. Symptoms are more often non-specific and clinically non-distinguishable from other febrile illness. Some are non-specific. They are not specific. They are oftenly non-specific. However, clinical severity varies, and severe cases may lead to the serious complication or even death. However, the clinical severity varies, and severe cases may lead to the serious complication and even the death. So, it occurs predominantly in association with the poor sanitation and lack of clean drinking water. If the conditions are hygienic, then the risk of the typhoid fever may be reduced. However, the contaminated food and water are the main reason in causing the typhoid. 3 typhoid vaccines are currently recommended by the WHO. The first one is injectable typhoid conjugate vaccine (TCV), consisting of VI polysaccharide antigen linked to the tetanus toxide protein, licensed for children from 6 months of age and adult up to 45 years of age. This is an injectable typhoid which are recommended for from the 6 month of the age and adult up to the 45 year of the age. An injectable unconjugated polysaccharide vaccine based on the purified VI antigen is an unconjugated polysaccharide vaccine based on the purified VI antigen known as the VIPS vaccine for the person aged 2 years and above. An oral life attenuated TY21A vaccine in a capsule formulation for those over 6 years of age. So there are three different vaccines recommended by WHO, which is like TCV, typhoid conjugated vaccine, in injectable form. Second one is the in injectable, second also injectable unconjugated polysaccharide vaccine, known as the purified VI antigen VIPS vaccine. And the third one is the oral life and it is an this is the third one is the oral life attenuated TY21A vaccine in a capsule formulation for so there is also an age limitation in these three vaccines. Typhoid, paratyphoid, enteric fever. Etiology. The main cause of the typhoid and paratyphoid is the Salmonella typhi or Salmonella paratyphi. So these are the main reasons, etiology, the cause of the typhoid. Transmission. Typhoid can be transmitted through oral fecal oral routes, from the feces, from the contaminated water, for the contaminated food. Spread. Patient, the spreading of the, like, how the typhoid can be spread. A patient can spread. If a patient have typhoid, it can spread. Second one is the carrier. Third one, often food handlers, like the food handlers, they are mostly like if they have contaminated food handler, and one person has a typhoid, they may and be a carrier to another. Organism live in the general body for months. The organism can live in the gallbladder for months, and year after recovery, even they have live in the body for years and months after recovery, and then pass into the stools, urine, less common. Most commonly, it gets excreted into the stool, and through food contamination in food, water, milk contamination, and infected shellfish. This is the pathophysiology of the the typhoid. Like if a person ingests contaminated food and then ingest bacilli invade small intestinal mucosa, taken up by the macrophages and transported to the regional lymph node. Like they are, like, for example, if a person ingests contaminated food, ingested bacilli invade the small intestinal mucosa, and they are taken by the macrophages and transported to the regional lymph node. Salmonella typhi multiply in the intestinal lymphoid tissue. Okay, intact with the enterocytes and the aerial pair patches during the first 3 weeks of incubation period. End of the incubation period, bacilli enter the bloodstream, like bacteremia phase, onset of the typhoid fever. Bacteria invade the gallbladder, biliary system, lymphatic tissues of the bowel, and multiply in the high number, then pass into the respiratory tract. Incubation period. Typhoid have 10 to 14 days incubation period, while the paratyphoid is 7 to 10 days. This incubation period of the typhoid and paratyphoid. Pathological features. After a few days of bacteremia, like when they enter into the bloodstream, so bacilli lodge mainly into the lymphoid tissues of the small gut, produce lesions, for example, pear patches and follicles. First swell, then ulcerate. First they swell and then ulcerate the region, then ultimately heal or may perforate and bleed. So these are some pathological features of the typhoid. Clinical features like typhoid incidence onset, like typhoid incidence onset. First week, like increased temperature in the step ladder fashion, increases stepwise, like from the 99 Fahrenheit to 100, 101, 2, increases step temperature in the step ladder fashion. Malaise, headache, drowsiness, and itching. These are the symptoms. They are mostly the patient in the first week of the infection may notice like malaise, headache, drowsiness, and itching. Cough may occur in the first week also. There is constipation also in the first week from the onset. Vomiting and diarrhea. Most commonly they are in the children, like they have vomiting, diarrhea. Relative bradycardia. They have relatively bradycardia in the first week. Pretty hard. End of the first week. Typical rash, upper abdominal and back. They are a typical, like they have the typical rashes in the upper abdominal and back. Slightly raised rose red spot fade on the pressure. So there are rose red spots. 7 to 10 days. In the first week, then 7 days to 7 to 10 days, spleen enlarges. Diarrhea with abdominal distension or tenderness. Delirious with cough and bronchitis. There is a bronchitis and cough is more. End of the second week, like profoundly ill, and in third week, delirium and other complications like toxemia and coma. Paratyphoid, more abrupt onset with acute enteritis, course shorter and milder. Complication of enteric like perforation and hemorrhage as a result of septicemia, cholecystitis, peritonitis, pneumonia, myocarditis, arthritis, osteomyelitis, meningitis. These are the complications because of the enteric fever. So treatment. General measures. In general measures is the isolation. So the patient should be isolated. Maintenance of nutrition and fluid balance. The mouth care, and then the prevention of pressure sores. Precaution to prevent the spread. Beside washing facilities, prevention to the spread gowns, spread gowns, etc. beside washing facilities. Drugs. Most commonly, uh, the drugs used in the treatment of this is a chloramphenicol, highly effective, decrease mortality and complication. So chloramphenicol is one of the drugs used which is highly effective, decreases mortality and complication. Initially 1 gram multiplied by 8 into every 8 hours, then 500 milligram every 6 hours up to 14 days. Amoxicillin cotrimoxazole is also recommended. Amoxicillin and cotrimoxazole. Alternate drug for the typhoid. Amoxicillin. It's a drug of choice for the paratyphoid. This is the drug of choice specifically in the case of the paratyphoid. Fluoroquinolones. Ofloxacin, norfloxacin, ciprofloxacin, these are the drugs. Fluoroquinolones normally used. Cephalosporins are also being recommended in case of the typhoid, the ceftriaxone 1 gram, 1 gram IV into the BD. So these are the drugs like chloramphenicol, the chloramphenicol, amoxicillin, chloroquine, and cephalosporin, cephalosporins. Chronic carriers say like 5% of the patient become carriers after recovery. Cotrimoxazoles is used for 2 to 3 days to 3 weeks specifically in case of the recommended for the paratyphoid. Chloramphenicol not effective in the case of the chronic carrier state. Cotrimoxazole is effective in case of the chronic carrier state. Sometimes cholecystectomy may be required. Patient considered ineffective until 6 consecutive urine and stool cultures are negative. Patient considered ineffective until 6 consecutive urine and stool cultures are negative. These are some the tests for the to identify or to eliminate the chronic carrier state symptoms. Preventions monovalent typhoid vaccine are used specifically in case of the chronic carrier state. So these are the references from the paper on typhoid and paratyphoid. Second one, there is the different vaccines and the different treatment measures taken from the WHO recommendations in 2019 for the typhoid. Thank you so much.